Thank you. Good morning, everyone. I'm thrilled to be here today. Thanks for having me. London is probably my favorite city, so that's another good reason for me to enjoy being here. So I want to start by giving you a bit of information about myself. I spent the first 25 years of my life in France, and then we moved to the UK, where we live here in London for 14 years. And most recently, we moved in the US for the past 10 years. So first of all, I should say, if you have any problem with the accent, just blame the Americans. But more seriously, I'm sharing this information because throughout my life, I've been exposed to 3 healthcare systems. And the French one, obviously, where I grew up, the NHS, thank you. My 2 children were born in St. Mary's Hospital, not far from here, in the NHS wing. And the US private and expensive system for the past 10 years. And what we're going to talk about today is applicable to all 3 systems. In fact, it's applicable to most healthcare systems around the world. So let's get started. The greatest wealth is health. Does anyone know who said this? No? So, sorry? No? There was someone before that. Virgil, he was a Roman poet, 2,000 years ago, and I think Virgil would be thrilled to see the progress we've made since then. Today, we live much longer and more comfortable lives than his contemporaries ever did. Progress, and that's thanks to progress in healthcare, in public health, in medical interventions such as sanitation, vaccinations, antibiotics, and all this have contributed to dramatic improvement in the way we live. However, those gains have not added to as many years of healthy life. For instance, and Vitek talked about it earlier, the average life expectancy in the UK is 82, not 122 as Jeanne Calment, French by the way. But it was 69 back in the 1950s, so massive progress has been made. But the Office of National Statistics has estimated that in the UK health span, the years of living a healthy life is only 63 years old. That means nearly 2 decades of living with medical issues and potentially being in care. And remember, the legal retirement age in the UK is 66, right? So what does that say about retirement? It's quality, if it's spent dealing with medical issues and without autonomy. So additionally, gains in life expectancies have tapered off in the past few decades, and that's way before COVID. So experts also are already warning us that our children will live less than ourselves, and that's the first time a generation have a lower lifespan. So today, I want to explore how we can reverse this trend and add more years of healthy life, not live longer, but more years of healthy life, through harnessing the technologies that exist today and have been advancing very recently, such as biowearable, AI, and behavioral science. So let's start with the current state of affairs. Chronic diseases have been a huge burden on our society and healthcare systems. That includes cardiovascular diseases, diabetes, dementia, cancer. Those are known as the 4 horsemen. In the US, the Centers of Disease Control report that 90% of healthcare expenditures are for people with chronic conditions. 60% of Americans have at least one chronic condition. 42% have multiple. Yes, the aging population is a significant driver of the higher prevalence of chronic diseases. But now the younger population is increasingly affected too. In 2020, 38% of the world's population over the age of 5 was overweight or obese. That figure is expected to get up to 51% in 2035. In the UK, researchers have found that type 2 diabetes is rising at a faster rate with people under 40 than with the aging population. That's an alarming trend. So when we think about what we could do to reverse this trend, existing research shows where the focus should be. So going back to the CDC reports that 80% of chronic diseases today are the results of lifestyle, not genetics. Only 20% are due to genetics. So that indicates that a significant reduction in this burden is actually possible It's preventable through lifestyle changes. Now, that sounds easy to say, but the way we live today is drastically different from ancient Rome or even the way our grandparents used to live. We are a lot more sedentary. We spend most of our days at our desk, at conferences like here, in cars or airplanes. We don't have to harvest for our food, let alone hunt for it. We have avocado in Instacart. They deliver it straight to your door or kitchen. So today, everything we do requires a lot less physical effort. In addition, we have access to an abundance of food 24/7. Most of what we consume is filled with refined sugar, processed carbohydrate, highly processed carbohydrates. So our food is much richer. Our food is much richer, and one could argue much more addictive as well. So this has been identified as the leading cause of the global increase in weight gains, metabolic dysfunction, diabetes, and heart disease. So in this context, adopting a healthier lifestyle is a major challenge, especially when you don't have the information or the support system to know what to do, what to change for, and even have the motivation in the first place to change if you feel relatively healthy in the first place. So our healthcare systems, which are optimized for sick care, dealing with diseases, are not currently designed to address that challenge. Don't get me wrong, there are countless lives that have been saved thanks to regular screening programs like colonoscopy, mammography, blood tests. Yet, early detection of a disease is not the same as prevention. And it hasn't been enough to curb this trend so far, so we need something new. Primary care providers have limited time to manage diseases, let alone the capacity to help people change their lifestyle. And as many of us know, health is what happened between doctor visits. So let me illustrate this with a personal story. 2 years ago, at my annual checkup, I was diagnosed with pre-diabetes. That came as a shock to me. I thought I was healthy. I exercise regularly. In my free time, you'll find me cycling, running, swimming outdoors. My family and I, we buy organic and eat mainly home-cooked meals. Yes, I have a sweet tooth. I like my croissant and my dessert and my chocolate, but I didn't think it would be such a big issue. So the doctors who tried to reassure me told me, don't worry, it's not you, it's your pancreas. No guilt, right? It's not you, it's your pancreas. It's normal, it's just getting old. Try to eat healthier, exercise a little bit more, and if things progress and develop into diabetes, we have a pill for that. So just come back, right? And so just like that, I was sent home with this alarming diagnostics in my mind, with not even a leaflet or a brochure. Just wait, basically. So short of the support of doctors, people who want to take charge of their health turn to their own devices. Changing your diet is one of the most prevalent solutions people rely on. However, for most, it just doesn't work, and efforts are short-lived. According to a US study, the average dieters try between 55 and 130 diets in their lifetime. 130 diets in their lifetime. That's a lot of effort and reset for a lot of failures. First, most diets are very restrictive. They are hard to follow. Then it takes longer than expected to see their impact, and often people give up before. And then finally, research has shown that the same diet will not impact everyone equally. So there is a large body of evidence already that shows that we all have different biology, and a one-size-fits-all approach to health doesn't consider how genes and metabolism make us process nutrients differently. So as a fun example, earlier this year at CES, I don't know if some of you were there, a Premier League football team shared some very interesting data to illustrate this point. Those two charts show the glucose levels of two players. Both had the same meal approximately 3 to 4 hours before the game. The first player, as you can see, reacted very well and started the game with a high glucose level, which showed he was performing at a high level. And then with proper nutrition, he maintained a high-level play for the duration of the game. However, the second player experienced a dip in performance after his meal. Although he recovered before the match, before the end of the match, well, no, before the match, sorry, his glucose level dropped in the second part of the game. His performance dropped as well, and he was taken out of the game. After looking at all the training and fitness data, the medical team concluded that it was a problem with the diet and nutrition. Therefore, they made some adjustments in his diet based on his own biology, and it was, future games, he performed very well throughout the game. So while this is an extreme example, for sure, let's say elite performance athletes, the fact remains that we are all unique and we need more personal insight on our own metabolism to understand how our diet affects us. But because changing habits is hard also, we also need a strong support system. We need continuous reinforcement, encouragement, validation that what we are doing is actually working. But we need an approach that can scale. We can't all have a Premier League medical team to support us, right? So how do we bring this level of personalization and support to all of us? Until now, one could argue that it wasn't possible. But thanks to a new category of consumer health tech, the bio-wearables, and recent advancements in AI, very recent advancement in AI, in fact, and behavioral science, we now have the ingredients for this solution. Bio-wearables, I don't know if you heard about them before, are a relatively new category of sensors. They reach beneath the skin to measure continuously key biomarkers like glucose, ketone, lactate, and many others that are coming. This technology allows us to see in real time how lifestyle choices, such as food, activities, or rest, will impact our health. And so a bio-wearable is like a window into your body. It makes the invisible visible. In addition, behavioral science has evolved significantly over the past few years. We now understand how habits are formed, repeated, or sustained. We know the importance of breaking down a goal into minor changes and the value of timely feedback, encouragement, and celebration. Finally, with recent AI advancements, we can make sense of a large body of data and identify key insights by bringing relevant context to it. So it's basically bringing the power of a clinician, a trained clinician, a personal coach, right here with you at all times to interpret your information. So by leveraging this new technology, we can make it easier for people to adopt healthier lifestyles, healthier habits. Abbott, the company I'm part of, has been at the forefront of this technology. And more than 10 years ago, Abbott introduced the Freestyle Libre. It's a biosensor. It was the first one, in fact, biosensor that now 5 million individuals around the world that have diabetes use on a daily basis. And so based on the same platform, we have developed a new glucose sensor adapted to the needs of the wider population. This sensor provides real-time insight on your metabolism in an easy-to-understand way for the average person. We call it Lingo. So we call it Lingo because it translates the language of your body. Lingo tracks your glucose level in real time and shows the impact of your diet and lifestyle on your metabolism and sleep quality. Now, with the power of AI and applying the key principles of behavioral science, the system identifies what's working for you, the areas of improvement, provide personalized coaching, and even suggest rewarding challenges to keep you engaged and motivated. We focused our first product on managing glucose because it's a critical biomarker of health for everyone. There is already a large body of research that links poor glucose management to the development of 18 chronic diseases, including the most prominent one, cardiovascular disease, cancer, Alzheimer's. By the way, it's nicknamed type 3 diabetes, and type 2 diabetes. So when we talk about chronic disease prevention, early glucose management is critical. And beyond preventing chronic diseases, poor glucose control has been linked also to conditions that impact our daily lives, from weight management, quality of sleep, energy level, women's health, and even mental health. The benefits are extensive. There's a lot of research on this topic. We introduced Lingo in the UK just late last year, and feedback from our customers has been extremely positive. Many have shared stories of the changes they have gone through, to improve their health. For me, telling about my personal story, it's only when I started to use the biomarker, the bio-wearable, Lingo, that I started to see real-time impact of what I was eating and what I needed to change in my diet to address my prediabetes. So I'll give you some example. I learned that my glucose spiked with some carbs, but not all. Potatoes don't make me spike. I grew up in the central part of France. We eat a lot of potatoes. Potatoes don't make me spike. Rice does, and bread as well. So I started to curb down on the bread. I eat walnut with my cheese. Not that typical. I cut rice completely, and I still indulge into French fries, guilt-free, because I know it works for me. Lingo also taught me that moving after a meal will lower my glucose. So now my wife and I, we go for an evening walk after dinner. It has become a healthy ritual for the both of us. And really, those changes may sound trivial, but this is changes like this that have helped me bring my diabetes number down, my glucose level down, to a level where now I'm in a healthy range. And I strongly believe that this is a sum of small, manageable changes that can make a huge difference. And being able to see in real time the impact of those changes is a great motivator. So solutions like Lingo will also allow for more meaningful conversation about our health amongst each other and with our doctors. And with the right consent, physicians will also have access to that information to monitor progress, but also to celebrate with you as you improve. And that happens between visits. At Abbott, we're working hard to transition to a true healthcare system based on prevention, a system that is more proactive, more connected, and more tailored to our individual needs. And while glucose is our first focus, as I mentioned earlier, we're working on other biomarkers like ketone, for instance, for those who want to be in ketosis, and lactate, more for athletes or weekend warriors, as we call them. So I'll leave you with this. Chronic diseases are creating a crisis that threatens our greatest wealth, our health. Now we have the tools, such as bio-wearables, to build an effective prevention solution that can reduce the incidence of those diseases. So in addition to helping people live healthier for longer, once implemented at scales, those solutions can also free up capacity in our healthcare system to better care for the very sick. So how is that for investing in our health? Thanks.